An additional probable case of COVID-19 has been identified. The newest probable positive case is a man in his 50s who lives in Winnipeg. At this time, the public health investigation indicates that this case is related to travel. In addition, another case initially described as probable has been ruled out and will be removed from the list. This means our total lab confirmed positive and probable positive cases in Manitoba remains at 20 at this time. Today, I'm strongly advising all Manitobans, including healthcare providers, to cancel or postpone any non-essential travel outside of Manitoba. This travel advice is regarding international travel as well as travel within Canada. In keeping with our social distancing strategies, now is not the time for essential travel. In addition, effective today and going forward, public health officials are recommending that anyone who returns from travel, including domestic travel, should self-isolate and self-monitor for symptoms for 14 days after their return. If any returning traveler develops symptoms within the 14-day period, they're advised to call HealthLinks for assessment of the need for testing. We know that the vast majority of cases in Canada, and certainly all of our cases in Manitoba, are related to travel. This is why it's essential that Manitobans who are returning from any travel self-isolate for 14 days. I want to make it clear that this is not just a suggestion. We have this in place because the risk to Manitobans is real since all of our cases so far have been imported from travel. We are appealing to people's civic duties and public health advice to follow these self-isolation guidelines. However, the Public Health Act allows us to issue orders if we find people are not following our advice and putting the risk of Manitobans at risk.